Good morning, everybody. Just give me a couple seconds here to allow access for recording, and then we'll get started shortly. If you're not muted, please do mute. Okay, I think we are all set. So without any further ado, I will introduce Dr. Michael White, Chief Clinical Officer at Valleywise Health, to give our bi-weekly or bi-monthly briefing on COVID-19 and beyond. So
recording in progress.
Well, good morning, and thank you all for joining us this morning here for our COVID-19 kind of situational awareness update here from within Valleywise Health. I am sorry to say that we continue to see a rise in the number of COVID-19 disease positive patients that we're seeing hospitalized, needing acute care within the medical center. Certainly, as we're following the data that's present within Maricopa County, as well as the state of Arizona, we've seen this case count suddenly and consistently rise over the last few weeks, which is being reflected in the number of patients that we're caring for here within the medical center. Today, I have over 40 patients within the medical center that are COVID-19 disease positive. We'll reference that back to, just 3 weeks ago, we were hovering down, around 20. So we're starting to see that increase of this. Around that, as we coming into the holiday season, this is of concern, for us as people are going to come together and celebrate the holidays around it. From there, the majority of the individuals continue to be that need hospitalization for severe illness continue to be those that have not received COVID-19 vaccine. So of those patients that are hospitalized today, 92% of them within Valleywise Health are not vaccinated. We know that COVID-19 vaccine is safe and effective in preventing that severe hospitalization around this. This is also coming at a time when our healthcare system is seeing a lot of pent-up demand and a lot of request for routine care or care that would need hospitalization. Our census is very high. Our staff is, continually getting beaten up here by the number of folks that we're seeing around this and putting increased strain within the system. We need to continue to work towards getting folks vaccinated against this disease to prevent, this larger influx that we may see. This is a disease, as we've talked about over the last 22 months, that is spread by, close contact and respiratory type spread. So if you are ill, certainly I would recommend that you stay home. Certainly, if you're going to be in an indoor area without folks that you live with, it is time to continue to wear a mask, even if you're vaccinated at this particular point, just with the amount of spread of this virus that we're seeing within the community. Also, I will plug at this time as we're moving into other respiratory virus season. It's also important to get immunized against influenza, and getting your flu shot is also important. Again, we want to do the things that we know are effective to decrease those folks that may have severe illness requiring hospitalization from there. So as we come into that holiday season again, if you're going to spend time with your family in close gatherings. Certainly, I would have encouraged everyone to be vaccinated as you're doing this. But if there are folks that are not vaccinated, considering certainly wearing a mask when you're with those individuals to decrease the spread of this particular virus. With that, I am going to pause my remarks, and I would be happy to answer questions.
Hey, it's Katie with KJZZ. We're hearing a lot about developments of other ways of treating COVID-19. Merck and Pfizer have antiviral pills in the works. We're hearing more about like monoclonal antibody type treatments. So I think there's maybe a bit of perception that it's easier to treat COVID patients now, but I don't think all of those things are necessarily happening on the ground quite yet. Can you kind of clarify like what you are able to do there as healthcare providers, even though that we've got these new treatments on the horizon?
Correct. And I absolutely a wonderful question there around it. Certainly, we've had monoclonal antibodies. So monoclonal antibodies have been available, for a while now through the pandemic. We know that they're most effective in those folks that were recently exposed to the virus to really kickstart your body's immune system to be able to fight off this. Again, it is already after you've contracted the virus that you're eligible from these. It does nothing to help prevent that spread or prevent you from getting severe illness. It's hopefully to help resolve some of that severe illness. The pills, that are in process of being studied and approved outside of the United States, none of the oral medications are yet approved, even with the emergency use within the United States. Pfizer recently submitted theirs to the FDA for this. We'll see as it comes, available for us to use. It is a tool, but it is not the most effective tool. They're used, again, after you've already contracted the virus, have some symptoms around this. We can use some prophylaxis with the monoclonal antibodies, but we know that vaccine is the most effective way to be able to prevent the spread of this virus.
And it's been many months now in Arizona since we've had any kind of mask requirements or business capacity restrictions, anything like that. Do you think it might be time to start looking at more public policy type solutions as we're moving into the winter season?
I certainly see, again, as we see this case count increase, certainly as we see, the community spread to the levels that's, again, approaching over 300 per 100,000, especially here within Maricopa County around this. We need to be vigilant as a community, start to wear, and again, masks as we're coming together in these indoor settings around this, certainly in areas where the ventilation is not good, and encourage these vaccines. We've got to make some changes if we're going to get in front of this.
Thanks.
Hi, Dr. White. It's Allie Bettner with KTAR. I have two questions for you. One is, I understand you have a rise in COVID-19 positive patients. So what does that mean for your ICU capacity and hospital capacity in total? And the second is, where are you at with vaccinations for employees?
Two wonderful questions. Today, our COVID, our ICU where we has our COVID positive patients is 90, I'm doing the math in my head real quick, is 96% full. I do have other ICU beds. I have another 8 ICU beds that are available within the hospital today. Our hospital census is overall, quite high, at this particular point from this. We're continue to have adult patients in areas of the hospital that we typically hadn't had adult patients in some of our pediatric areas as well from there. We still have some capacity, but we're stretched, thin. And again, it's a multifactorial thing. It's not just the available space to be able to take care of folks, but it's the qualified healthcare professionals that, and the team that we need to be able to care for patients at the ICU level of care, at that med-surg level of care, as they're in the hospitalization. And as we've seen our staffing challenges persist, as we've talked about over the last number of months around that, it continues to exacerbate the problem where we have, patients that may need hospitalization, where we don't have, either physical space or, more importantly, the team members to be able to take care of them. I'm happy to report on the vaccine front from our overall of our employees that have received the COVID-19 vaccination, we are at 99% of individuals that are able to take the COVID-19 vaccine or apply for one of the exemptions around that. So as an organization, we have done very, very well about getting folks in adherence with our COVID-19 policies around vaccine.
Very good. Thank you.
Hi, Dr. White. It's Stephanie Innes from the Arizona Republic. I just wanted to ask you about the price of travel nurses. Seems to be very high. Does that cause a problem for a medical facility like Valleywise, that might not have the resources of other systems? Yes.
So the current rates for being able to attract and secure contract labor continue to escalate within the state of Arizona around this. When you're a safety net public healthcare system such as Valleywise Health, it does put us at a disadvantage to be able to keep up with rates of some of the other hospital systems within the market. Valleywise Health here too has been had other complications around some of the funding that's been available, from federal support around this. As you know, there were various tranches of federal funding that have been released throughout the pandemic. We were able to secure funding in the first phase of the CARES Act. And the second phase that was designated for safety net hospitals, much like Valleywise Health, on a federal level, we received none of that allocation due to the fact that we had successfully, funded Proposition 480 within Maricopa County for our overall capital projects around construction of the new federally qualified health centers, as well as the new hospital tower. The way that was reported to the Medicare and the way the calculations were done, it made Valleywise Health ineligible, even though we can never use those dollars from Proposition 480 to support any staffing. They're only there to support capital projects around that. So it's significantly put us at a disadvantage to do that, Stephanie. So yes, we have been disadvantaged around that.
And how are your staffing levels right now?
We continue to recruit nursing, respiratory therapists, pharmacists, pharmacy techs, behavioral health techs throughout the organization. We were running 30 short this morning within the behavioral health facilities, all of them across, within our footprint. And we were 12 nurses short here within the medical center when we started the day this morning.
Thank you.
You're welcome.
Dr. White, this is Daniela Zavala from Univision. I have two questions. One is about the intensive care units. Could you tell us how much percentage of those units are occupied by COVID patients? And the other question is regarding the pediatric hospitalizations. Another hospital system has reported that they have seen an increase of pediatric hospitalizations after being flat for about 8 weeks. Is that what you guys are seeing as well in Valleywise?
So I'll take the second question first. We have not seen an increase in the number of pediatric patients that we've been having hospitalized within Valleywise Health. Our number has been fairly constant and fairly steady. It really hasn't varied. And it's been a very small number, which oftentimes we don't have any pediatric patients. We may have one or two, and I have not seen that number go exponentially increase around that. The percentage of COVID positive patients today that we have that are requiring ICU level of care as a proportion to our ICU level of beds is I have 20% of my ICU beds that have COVID positive patients in it today.
Any final questions today for Dr. White?
Well, if there is no other question, I have one, and it's related to what you were talking about the holidays coming up, both Thanksgiving and also Christmas. And right now, there are families that have mixed vaccination status. For example, you have parents who are vaccinated, grandparents who are vaccinated, but there are kids that are not still eligible for vaccination. And so I wanted you to give us advice for those parents who might have these mixed situations of what they can do and they shouldn't avoid with those kids that unfortunately, cannot be immunized, would be okay for them to travel to another state to visit relatives? Is it okay to go into, gatherings with other households?
Yeah, every family situation is unique when it comes to this and comes to this issue. Certainly, my recommendations and what we would do in my own family are the following around this. Certainly, if anybody is feeling ill or having some sort of respiratory illness, I would not, travel or interact with other folks until those symptoms resolved around that. If I was coming together with people that had mixed vaccination status, those that were vaccinated versus those that were not vaccinated, I would ask everyone that was coming together in that setting, number one, is be outside if we can. If we can be outside, that is the safest place for us to be as we celebrate the holidays. If we can't, then I would recommend wearing masks, in that environment for around those folks that you don't live with around that. Those are going to be the safest measures that we can have to reduce the spread of this virus. Nothing is 100%. None of these measures are 100%, but those would be the safest recommendations that I would have. Any last questions this morning?
Hi, Dr. White. I'm Karen Marroquin from Cronkite News. So just really quick, there's a report that states that COVID is the #1 killer in Arizona. Now, other people are saying that it's lung disease. Can you talk a little bit about this and what can we expect with the upcoming holiday season?
Certainly, we've certainly, as we've looked back, over the last year, as you articulated well, COVID has become, the #1 cause of death, here within the state of Arizona with this virus. Certainly, as we see the case counts increase, as we see this virus spread, death is a lagging indicator. We see the number of infections increase, we see the number of hospitalizations increase, and then unfortunately, we see the number of deaths follow behind that, around that. Is if the infection continues to persist, as the infection rate goes up, the hospitalization rate goes up, we will likely see that death count, unfortunately, increase as well. So again, as we're coming into the holiday season, my recommendations are, if you have the opportunity to get vaccinated and you have not been vaccinated, please consider getting vaccinated around this. And again, if you're going to spend time indoors with folks where you may not know the vaccine status of them, I would consider wearing a mask. We will likely see this increase, again, as these numbers increase, unfortunately, as we get closer to the holidays.
Thank you.
Well, again, my continued thanks for everyone's support and carrying the message forward. I certainly wish everybody a safe and happy holidays. Again, if you have not been vaccinated, consider being vaccinated against COVID-19 disease. If you're in one of the eligible age groups to be able to receive, one of the booster immunizations, I would consider that as well. Certainly get your flu shots, and I hope everyone has a wonderful holiday. So thank you all.
Thank you.
Thank you.